Hello, my name is Karina Gonzalez, and I am currently a public health analyst working as a health education fellow for a nonprofit organization. My educational background includes a Bachelor of Science and Arts degree in Human Development and Family Sciences, a business minor, and a certificate in pre-health sciences. Throughout my time in undergrad, I was strictly pre-med. I don't even think that I really knew what public health was, let alone that I was going to be pursuing a career in this field. I participated in two medical brigades, and it was in the second brigade where I really got a glimpse into what public health was. We were in Ghana, and we were going to visit local schools, and we got to give health education lessons on how to properly brush your teeth, how to use a mosquito net to protect against malaria, what foods you should be eating to get the most nutritional value. And we got to build latrines for some of the local communities. It was on that trip that I realized that there was a massive intersection between healthcare and public health, and that I started to think this is where I want to work. I ended up taking an intro to public health course in my last year of undergrad, and I started to really get curious about the field. However, I didn't pursue it. I took a year off between my undergrad and my master's program, and I worked as a medical assistant for a pain management clinic. And it was at this clinic that one of my bosses ended up having a master's in public health. And so him and I would go back and forth about the pros and cons between a master's degree and going to medical school. And I ultimately decided to put a pin in going to medical school and pursue a master's in public health. And so I ended up pursuing a master's in global health with a concentration in infectious diseases and a certificate in complex humanitarian emergencies. I am incredibly proud of myself for taking a leap of faith in my education and in myself personally in my education because I was pursuing something that I wasn't really sure I fully understood, but I was curious and I knew that it would lead me to somehow eventually end up back in some capacity, one way or another, in a healthcare space. I wasn't sure how, but I knew that I was going to make that happen. And proud of myself personally because I took a leap of faith and moved to a place that I had never even visited. And it is one of the best decisions that I could have ever made for myself. And I'm so incredibly happy that I did. In those 2 years, I got to work as a research assistant with with a school of medicine. I got to work on an implementation project that impacted the Latinx community of Metro Atlanta, and we got to help them receive HIV resources. And this program is now also being adopted by a county board of health, and it is published in two or three papers, I believe. And so it's work that I am incredibly proud of because as a Latina, I got to contribute to the Latinx population, and I got to just work with like-minded individuals. And as my first real experience in public health, I found it to be incredibly rewarding. I also got to do a few fellowships as with nonprofit organizations. I got to be a contractor for a nonprofit organization throughout my 2 years. I got to work with a lot of amazing professors. I got to work with a lot of amazing classmates. And these are connections that I'm going to hold near and dear to my heart for the rest of my life. I'm still very close and I still keep those connections because keeping those connections, especially in the field of public health, is incredibly important. Since then, I believe that all those opportunities that I got throughout those 2 years helped me when I was pursuing my current fellowship. And I've been at this fellowship for the last 2 years since I graduated. And so I currently work in the health education space, but I did start out in a data analysis capacity. I've since transitioned to health education, and I find it to be a little bit more on my a little bit more of what I would like to do. And I believe that it's helping me eventually get back into the healthcare space because I'm learning a lot about evaluation projects. I'm learning a lot about surveys and implementing programs, which are all important skills to have. My overall skills include networking skills, communication skills. I'm learning a lot about leadership and how to gain leadership skills. Global health work is nothing but collaboration, so collaboration is some skills that I'm continuing to build on every day in my fellowship. Much of my typical day involves evaluating projects. So I'm currently working on a pretty big evaluation project, and that's what takes up most of my day. I'm evaluating surveys and analyzing those results and interpreting them and presenting them to my superiors so that hopefully it can help them in whatever capacity they need, whether it's to make changes, whether it's just to see how well something is doing. And so that is what my day-to-day looks like. I am also in the process of of taking the Certified Health Education Specialist exam. And so I'm currently studying for that. And I will be starting school again in August to pursue my Master's of Health Administration. Because I believe that ultimately the combination of my MPH and my future MHA will help me get to the place where I want to be, and that is in the hospital, making executive level decisions and implementing programs that benefit patient satisfaction and that positively affect and positive up our preparedness for when the next outbreak happens. I spend a significant amount of time as well mentoring students. It's one of the most fulfilling things that I do. I love talking to students. I love hearing about their classes, their coursework, what they're planning to take their next semester, what their practicums are going to be, what they're planning to write their thesis on. I love getting to just sit down and hear someone's story and how they got here, how they got to this point of their lives. I love hearing what they're loving about their program, even maybe what they're not liking so much. I like just being someone that they can talk to and hopefully guiding them in the right direction so that they can have the amazing experience that I had. And l- saying that leads me to my advice of if you're planning to pursue a career in public health, one of my biggest pieces of advice is to find a mentor that really takes an interest in you, that really cares about you, that really wants to see you succeed because my mentor is part of the reason that I had such an amazing experience in my master's program. She cared about me. She took the time to listen as I through all the different fields of public health because you're constantly getting fed more jobs or more opportunities that you didn't really realize were public health. And she helped me sift through all of it, helped me kind of keep me on, not keep me, but find the path that I wanted to stay on. She was my sounding board. She gave me great advice, and she also just listened when I didn't want advice. I just wanted to rant. She was an amazing person to have throughout my program. And so one of my biggest pieces of advice is to find a mentor, whether it's an advisor, whether it's a friend, whether it's another colleague in your program, whether it's a professor, just find somebody that's going to help you stay curious, help you stay motivated, and somebody that's just going to be a good sounding board. My second piece of advice is to network, network, network. I didn't realize how important it is to network until I was already a master's student, but those skills could have benefited me as an undergrad as well. It's truly what you learn in your classes is incredibly important, but the people you meet are just as important because public health is so connected that you could run into this person in 20 years and you can easily reignite that connection. And you never know how that could play out and how that could work in either of your benefits. And so I would say network, network, network. It could also be how you get a job or how you get an internship or a research position or just a shadowing position, anything to get your foot in the door in the public health world. They're just your resources are everything. And so networking is incredibly important. I would also say that my last piece of advice would be that if you choose for students choosing or considering a career in public health, when you're in school and you're studying public health and you're gaining all of these skills, I would say to gain a little bit of skills in a lot of different buckets, gain a little bit of skills in a lot of different areas, and then hone in on a few that you really, really enjoy. But I think that it's important to even have a background in a lot of different areas rather than just being incredibly good at just one particular thing because there are so many different facets of public health. So I think that it's important to have a wide range of skills. And eventually you can hone in on that depending on the job, depending on the internship, depending on the project. You can find time and hopefully your project lead, your boss will let you take a course or take or train you in this specific one, but at least you in that specific skill set, but at least you also have a background in a bunch of different things. It just keeps your doors open and it doesn't shut you off from a bunch of opportunities. And so those are my three biggest pieces of advice for students considering a career in public health. I think that it is a wonderful field. It is growing. There is so many opportunities. And I also think that it's just important to stay flexible because it's constantly changing and get creative because there's so many different facets to public health. There's so many different things that are considered public health that you may not even know about yet. So stay open, stay creative, and stay flexible. And I think that you can do amazing things in this field if you choose to pursue it. I think that you'll have an amazing time working in this field if you choose to pursue it. It is a field with some of the most amazing people that I have ever had the pleasure of working with, and it's a field that I love. And so stay creative, stay curious, and stay flexible. I wish you nothing but the best in whatever path you choose to take.